Welcome to Health Across America, a segment where we answer your health questions. This is presented by Heartwise Ministries, and if you have a question, visit us online at heartwiseministries.org. Click on the Ask the Doctor page, and you can leave us a question there, and we'll try and fit it in on one of our next segments. And Dr. Marcum, we've got a great question today about angina.
Okay.
First of all, what is angina?
Well, angina is a discomfort or a symptom that happens when your heart's not getting enough blood. That usually happens when you're doing something and goes away when you rest. So let's say you're a big bicyclist, right?
Yep.
If you started riding your bike up a hill and your heart went, let's say, how fast does your heart go when you really huff it on the bike?
About 182 or 3.
Woo, that's too fast. But if you ever started having chest pain, okay, and you said, man, this doesn't feel right. So hopefully you would slow down.
Right.
And if it got below 150, the pain went away, then you could say, well, maybe I have blockages in my arteries that were causing those symptoms, and my heart can't supply what it needs to, and I'm having that symptom. So when you do things, if you have a symptom that goes away when you rest, that's the definition of angina.
Okay, so if someone's experiencing this, their question was, what do you do about it?
Yeah, well, I would see my doctor about it right away, and they want to confirm whether it's angina or some other problem. Now, how would I treat it? Okay, lots of people come to me with angina that have already had modern medicine, and the modern medicine, sometimes it treats it with stents, sometimes with bypasses, sometimes with medications, especially one called nitroglycerin. You've heard of that, where they put it under your tongue. You know, the guy grabs their chest and you get nitroglycerin. Oh, I feel so good.
Yeah.
But see, the active ingredients is the nitrates. And sometimes I found out that we can change our diet and treat angina by getting rid of the cause. Usually modern medicine just treats the symptoms and not the cause.
Right.
Well, the cause is we get too much cholesterol and fat in our diets. We're eating animal-based products, which makes animal protein, which increases cholesterol, keeps the arteries from getting bigger, so we have symptoms. So one of the things that I try to prescribe is foods with nitrates in them, plants. And one of the best plants with nitrates in it, a lot of studies have been done on beets. Okay, beets have nitrates, but beets don't have as much as greens do, especially one of my favorite greens, which is arugula. That has some of the highest nitrates. So I'd use that in certain patients. I'll have them just grab some and chew it 3 times a day and use that to make nitrates, which makes the arteries bigger, to help fight the angina so they don't have to take as many medicines. Not only does that make the arteries bigger so they don't hurt as much, but they usually eat less fatty foods. They can start moving towards a plant-based diet. And then they realize, yeah, when I start eating well, I get rid of the cause of angina to begin with. So that's sort of my approach to angina. But if you're having pain when you do things, especially pain when you're riding your bike, go see your doctor, see if you might be having angina. And if you unfortunately might be a person that has angina, ask your doctor and read about going to a plant-based diet, lots of greens, beets, removing some of that animal-based protein, animal-based fat that might be triggering some of your systems. I think I would rather get at the cause and just treat symptoms. Now, you've heard a lot about fake news, haven't you?
Sure, yep, lots of that.
Well, no one knows where to go for good information. Well, at Heartwise, we're not making any money. We look at the literature. We try to give a balanced approach, the place for modern medicine, the place for lifestyle medicine, and give you, the listener, the ability to make a choice. And if I was voting to whether treat a symptom or treat the cause and not have to treat symptoms forever, I'd vote to treat it a cause.
I've been listening to what you've been talking about, and I've been trying to eat more nitrates from greens.
Tell me, how you doing?
Well, I didn't do very good this week because I went down to our local grocery store here by the office, and somebody had bought all the arugula.
Uh-oh, that might have been me.
Yeah, I think it was.
But we could all, I wonder if we could grow that. We could start a little
garden.
Arugula with some greens. And you remember, the other greens have nitrates in them too, but maybe not as concentrated. That's a good way.
That's what I did. I got some of the other greens.
That's the way to go. So I think there's great benefits to treat as well as prevent disease from a whole food plant. You remember that doctor from the Greek? What was his name, Nick?
Oh, Hippocrates?
Yes.
Right.
He had a famous saying. He says, let food be thy medicine and medicine be thy food. So arugula and greens are a treatment for disease. Not only helps prevent it, but you can use your plant-based diet to treat disease as well.
All right, sounds like some great advice. And thank you for tuning in. If you have a question, visit us on our website at heartwiseministries.org, and we'll try and get your answer in on the next segment. Thanks so much for joining us, and we'll see you next time.